The CanMEDS model becomes very, very useful when you're dealt or when you're faced with a really challenging situation where you've got to think about a broad range of issues. When you have the CanMEDS model in mind, the different domains of the CanMEDS, you're able to come up with a management plan that addresses the issues. And if this was an OSCE, for example, you would start off saying this case or this particular issue, this particular situation raises a number of issues. And really I'm thinking about the CanMEDS model when I'm talking about it. Very, very relevant for consultant interviews in the future as well. So let's look at what are the different domains. We'll start off with the professional domain. So you'll notice that when you come across challenging situations in the MEQ, you'll be forced to think about professional. What does that mean? It means two things. The ethical aspects, which are autonomy and capacity. Next, beneficence, acting in the best interest of the patient. Third, non-maleficence, do no harm. Privacy and confidentiality. These are the key domains that you're thinking in terms of the ethical issues. Medical legal aspects are really the overlap, forensic involvement, mandatory reporting, etc. So that's the first prompt. The second prompt is educator. What does that mean? The educator domain consists of you acting as a psychoeducator to patients, families, other medical professionals, for example, in the consultation liaison team, nurses, etc., medical students. Next, collaborator. Collaborator is how you actually implement a collaborative approach. For example, stating that you would arrange a face-to-face meeting and then you would listen, you will understand, and you will acknowledge the concerns, for example. This is part of collaboration. Collaboration is also about how to manage team conflict. So if you had a conflict in the ward because staff members are disagreeing with how to treat a certain patient, you would arrange a meeting to understand what the respective concerns are, and then based on those concerns attempt to solve the problem. That's the collaborative nature. Next comes manager. The managerial role consists really about clinical governance aspects. In clinical governance you have things like risk management, so root cause analysis comes up, incident information management systems, etc. So it's really the clinical governance aspects. If I go through the components of clinical governance very, very quickly, it's risk management, evidence-based management, continuing professional development, quality improvement project, QIP, also known as an audit, information technology, and an attitude of openness and transparency within the service. So these are the domains of clinical governance. Then we come to advocate. Your role as an advocate for the patient. And this is not just about advocacy at a individual level, but also at a wider level. So you acting as an advocate from a public health perspective, public education, for example, education in schools, at an individual level, involvement of the carer consumer consultants, involvement of carer consumer consultant ward rounds, for example. So these are relevant management strategies and that are individualized to the situation. Then you can think about the clinician role. Now, most clinician roles we tend to do well because this is about diagnosis and medication management, psychological strategy management, social management, etc. And finally, scholar. This is about appraising a paper. This is also about learning from incidents, etc. So the CanMEDS model really will help you solve or create a framework to address challenging situations when you come across them.